Good afternoon, everyone. My name is Gayla McLean, and I'm with the End Stage Renal Disease National Coordinating Center. So welcome to our June 22nd Learning in Action Network call, where we're going to focus on vaccination. So thank you so much for joining. Our title for today's event is Developing and Sustaining Processes to Improve Vaccination Acceptance. Close that out for improved vaccination acceptance. So again, thank you for joining our call today, and you're in for a treat. We have two of our of our 18 networks that's going to be presenting today, and with facilitators, with them speakers as well, that's going to share a lot about the great BDPs that's happening in their demographic area, the geography, on what they're doing to really improve on vaccinations. So just a reminder regarding a few reminders for media logistics. The call is being recorded, and all participants upon joining the call were placed on mute, but we absolutely want to hear from you. So please note your chat box at the bottom right-hand side of your screen. We want you to drop in comments, questions, and we'll definitely give that attention and respond to those questions and comments as we go throughout our presentation today. And also our meeting materials will be posted on our ESRD NCC website within the next 5 to 7 business days. We definitely have previous LAN call recordings there as well. So feel free to check out some of the previous calls if you missed those. And the call today will also be placed in that same general area. So who's on the call today? We have many of our dialysis facilities and transplant professionals. We have our ESRD network staff. We have leadership from Centers for Medicare and Medicaid Services, as well as patients and families that may be on the call today. So again, welcome to the call, and we're so excited to have you here with us today. So our key objectives and what we're going to try to accomplish is really understanding and overcoming some of the common barriers that for our dialysis patients as it relates to vaccinations, and learning some best demonstrated practices of how we can improve, and work through some of those barriers. We also want to identify processes for tracking and trending and sustaining improvement across the various different vaccinations that are offered to our patients. And then we also want to identify some effective resources for patients and families as it relates to education. So ways that we can continue to spread the importance of vaccinations to our patients and families and staff. And ways to spread best practices from today's LAN calls. So for those, if this is your first opportunity joining this type of call, a LAN call is known as a Learning in Action Network. And so it's a forum to really bring people together around a shared idea, which as it relates to today's call is on vaccination. We want to look at opportunities and challenges and ways that we can support each other by offering best demonstrated practices. You may be requesting information to help resolve some challenges you're having in your facility, and also just sharing experiences in ways that we all can show some sustained improvement across our different geographies. We want to listen. And so by listening, we ask that for the next few minutes, you really just try to minimize distractions and really listen to what some of our speakers have to share in ways that they've approached improving this outcome. But again, we also want to hear from our audience, so feel free to pop questions, comments in the chat box. We want to think about ways to identify some of those best demonstrated practices and how you can share it and it can be used in your facility. and really just try to apply and take one idea from today's presentation in ways that you can really spread that learning and turn some of these learnings into action in your facility. And then also commit to sharing what you've learned with other colleagues in your organization and invite them to upcoming land calls that are being offered. And so questions that run on are really just kind of thought-provoking questions that you to kind of think about as you're listening to the presentation. So some of those ideas would be, what concept did you hear today? Something new that maybe you can introduce to your leadership team. How might your organization use the change package, which we're going to talk about that a little bit, but how can you use those change ideas to improve outcomes in your organization? And in what ways within your organization can you adapt new approaches to increase and sustain those improved outcomes? And so those are, again, some concepts, some thoughts to kind of keep in mind as you're listening to today's presentation. So we want to start with a quick poll question. Have you previously used best practices from the change package to improve your clinical outcomes? And maybe, maybe you haven't had an opportunity to attend one of our land calls previously and not quite sure what the change packages are. So we're definitely going to spend some time talking about that, but we definitely want to hear from you. So if you've previously used the change packet, if you can drop in yes or no in the chat section, that would be super helpful. All right. Okay, so I see a couple of yeses and also first timers, so no worries whatsoever. So we'll definitely spend a little time just kind of talking through what those change packages are. And hopefully by the end of the presentation, you'll see the value in taking away some of those best practices and go on our website and learn more about the different change packages. So here's an example of the change packages. Change packages are a collection of best demonstrated practices that high-performing facilities have shared. And in gathering that information, we have conducted semi-structured interviews with high-performing facilities and just really learning about what are some of the ideas or what are some of the practices that you've put in place that have really shown some great outcomes. And so we've collected that information and created these change packages. So we have several. Here's just an example of 4 of those change packages. So home dialysis, patient experience of care, kidney transplantation. We're going to discuss the vaccination change package today. There's also a change package on access to care in the nursing home, as well as health equity. And so all of those change packages are located on our website. So we definitely would encourage you to spend some time, think about some of the challenges you're having in your organization, and just kind of see what your colleagues are doing to really have to show improvement and to sustain that improvement, and see which of those ideas you can implement in your facility. So a little bit deeper detail about the vaccination change package. So as you're looking at the table of contents, it gives you some background detail of how this change package became to be, but also focusing on primary drivers and secondary drivers. So primary drivers are those bold aims that you're trying to achieve and trying to sustain improvement on. And the secondary drivers are actionable change ideas that have been tried and proven by different facilities and they're sharing their best demonstrated practices. And so that allows you to really focus on those actionable things that different facilities have implemented in their facilities, and different interventions that facilities have implemented, and as well as the great outcomes that they've achieved, which has led them to be high performing facilities. So it's just a menu, a collection of ideas that you can try. So we definitely encourage you to, again, go on our website and look and see what your colleagues are doing, and how you can have sustained improvement. And so today's presentation is going to focus on vaccination, and you're going to hear from two networks that are going to share how they've, utilized some of those ideas, and different other ideas that may not be in the change package as of right now, but different things that they've done that has really shown some sustained improvement in their organization. And with that being said, I'd like to turn the call over to our first speaker, Network 4. So we have Jeannette Shrift. Jeannette is the Network Quality Improvement Specialist Lead for Network 4, which covers the Delaware and Pennsylvania area. So Jeannette, welcome to the call, and thank you for being here today.
Thank you, Gail. It's very nice to be here. Good afternoon, everyone. I have brought Chris Bassler, who is a regional director at Dialyze Direct, and Paul Gordan, who is the social worker, and he is the director of clinical projects. Their business model is to provide dialysis care to patients in the nursing home. So Chris and Paul had a bit of a unique challenges over the past year, and I'll let them get into that a little bit with you. But I'm really glad that they could come today and share their experiences with us.
Thank you, Jeannette. As she stated, my name is Chris. I'm the regional director for Dialyze Direct. With me, I have Paul, who is the director of projects for us. Who's in control of the slides right now? Can I just ask that?
Yes. Are you ready to move to, just say next slide when you're ready to move forward?
Okay, next slide.
All right.
So as Jeannette stated, we have some unique challenges within our organization. Dialyze Direct is a company that, for the most part, deals with strictly dialyzing patients inside SNFs, skilled nursing facilities. We operate in 14 states, and in the state of Pennsylvania, we have 21 sites. One of those sites is an outpatient center. The other 20 are all located within the SNF, nursing home. Some of the unique challenges that we face that are a lot different from the normal outpatient facilities include the geriatric patients that we have. Obviously, most of the patients that are in the nursing homes are geriatric. Another aspect of that is that most of all of our patients that come to us are coming directly from the hospital. We're stationed in the nursing home, and how we get our patients is when a dialysis patient is discharged from the hospital and needs either long-term stay at a SNF or rehab at a SNF, then they come to us and dialyze with us, either while they're there, again, if it's short-term for rehab, or if it's long-term, for the rest of their life. So most of our patients are geriatric. Most of our patients have high acuity. Again, they're in the nursing homes. They're not able to live in the community by themselves. And even if they are a little bit younger, they're coming from the hospital and are needing that higher acuity of care. So those two things really give us a different population of patients than the normal outpatient setting that you see in the chronic facilities. Another thing is that being in the nursing home, we need to work hand in hand with the nursing home staff. And at times that presents its own unique challenge. The nursing home staff have been hit by the pandemic the same way that, all of us dialysis units have, right? Nurses are harder to come by, CNAs are harder to come by. So many times they're short-staffed, many times there's a very high turnover, many times they're using agency in there. So to maintain a level of communication with people that you're familiar with, becomes a challenge because it seems like it's always a revolving door. And even if the turnover isn't high, if you're having an agency nurse or CNA come in and they're just working there a day or two, they're not familiar with the dialysis program. They're not familiar with what needs to be done. So that communication with those staff members becomes a challenge. And then linked to that is the limited dialysis knowledge that the SNF have. So when we go into a SNF, we spend time educating all of their staff members on, dialysis therapy, what they need to be aware of, what needs to be done each day for us to dialyze the patients, and what they need to observe for afterwards. But again, with this high turnover, the education needs to be nonstop, and unfortunately, it's hard to keep up with that. And again, you add agency staff into that are only there a day or two, and really have no idea what's going on with dialysis. So group all these things together, and we're definitely in a very unique setting that presents its own challenges. Next slide, please.
It doesn't go without saying, can't overstate.
Sorry.
Like Chris was saying, with this high acuity rate, so many of these people, they may be new to dialysis coming from the hospital. They may actually have dialysis experience, but they've got a whole new issue that they're dealing with. We have people on ventilators. We have people with all kinds of maybe new CVAs, new amputations. So it just is just a heightened level of acuity in 100% of our cases.
Absolutely. Thank you. Next slide. So what we're here to discuss today is the barriers and issues that we've had with documenting NHSN vaccinations. We're going to focus specifically on COVID vaccinations for most of the verbiage, but this goes hand in hand with, influenza vaccinations, pneumonia vaccinations. They're all the same issues that we've had. So some barriers that we've had personally within our organization was an acquisition. About a year and a couple months ago, we acquired a company called Compass. And during the acquisition, we had leaders from both companies merging together. And some of the roles and the responsibilities were very foggy during that timeline. And people weren't sure who was supposed to be doing what. And it took some time for us to figure that out. Again, delineation of responsibilities and changing of roles. We had, certain people moving up, certain people moving down. Again, not sure with the previous company, I was doing this. With the new company, am I supposed to do this? And likewise, with people on both sides. We had leadership turnover. So, unfortunately, during that same time period, we had a bunch of leaders from Dialyze Direct leave. And, in the gray area, it was unclear again as to, this process was being done, but now they left and there's no real start of a new process. So we had to create that new process. Again, dealing with staffing crisis, as we all have dealt with throughout the pandemic. During all this change, all this movement, we had our own leaders, area managers, regional director, working the floor constantly to provide care to our patients, so we didn't have to, shut down, and we wanted to make sure, these patients were treated properly. So that took, another focus off of this reporting system. And then at the end of the day, the absolute biggest challenge was obtaining access to NHSN. I myself came from the previous company, and I had access to NHSN through that company. But the prior leadership within Dialyze Direct didn't pass that along prior to leaving. So when I went and attempted to gain this access, it was extremely difficult. It was not easy because, as you may or may not know, NHSN really doesn't have a phone number you can call. It's all exchanged through emails, which sometimes takes days. And there was a lot of confusion in exactly what I was asking for and what I needed and what they thought I needed. And then again, obtaining the vaccination statuses from the nursing homes, its own challenge. You know, it'd be great, but it's not as simple as, you know, them walking up to you.
I think you may have muted yourself, Chris.
I'm sorry. We had to create a process as to how we were going to obtain this information. Again, especially with, you know, the changeover in leadership from the nursing homes, changeover of their staff members. Anything to add on that, Paul?
No, other than to say, you know, any of us working in this field can imagine, like it's almost bifactorial. It's almost double, because just communicating like working in an outpatient setting, you know, it's been all hands on deck. Everybody knows in dialysis, if you have an RN license, it doesn't matter if you're the vice president of the United States, you got to be on the floor right now. We need all hands on deck. So the nursing homes were kind of in the same situation, and so it really left no really availability. It was like you were in constant triage mode, I guess I would say. No avail. It made it very difficult to try and formulate these process, because everyone that was a permanent member of staff was doing all that they could do to take care of the patients.
Correct. Absolutely. Next slide, please. So obviously we identified these problems and realized that we need to fix them. So, you know, our way of resolving this was we had a little internal root cause analysis to identify our barriers and develop the solutions that we needed. So number one, in order for us to get the information from the nursing homes, we decided to identify a point person at each SNF that our nurses could go to and get the vaccination reports. So this was on a weekly basis at that point. You know, most of the time it was the infection control person in the nursing home. Sometimes it was the admissions director. I mean, every nursing home was different, but each nursing home we identified a point person that our nurse would go to, and they would present us with a list of each patient we had and the vaccinations that they had. Whether that was in paper form, email form, didn't really matter as long as we got that information. Our nurses then would relay that back to our administrative assistant, and who assists us with entering that documentation into NHSN. Staffing improved. Thankfully, you know, the pandemic at least declined during that point. We were able to fill a lot of our nursing and PCT holes, and our leadership team was able to actually get off the floor and get focused on the things that needed to be done, this being one of them. And then obviously the biggest thing was the NHSN access. You know, we can have all the COVID vaccination reports we want. We can have, you know, us sitting around a table doing a root cause analysis, but if we have nowhere to enter the documentation, then we can't enter it. So again, this was a very difficult process for us, and a timely, lengthy process for us. Again, we exchange emails back and forth because there's no phone number for them. But again, these emails didn't really get anywhere. You'd send an email, you get a response a couple days, a week later. It's not what you needed. Send another one. They'd say it was fixed. It wasn't fixed. It was frustrating, to say the least. Finally, you know, well, not finally, Jeannette from Network 4 was working with us the entire time to get us access to it. And, you know, she was involved in the emails, as was myself and Paul, and, you know, we just weren't getting anywhere. Fortunately, she had a few contacts within NHSN that she was able to reach out to and finally get us on the phone with them so we could, you know, in real time discuss what we needed and what wasn't working, and what we had to do to correct this. And eventually we were able to obtain our access. So with our access obtained, with us identifying a point person at each nursing home that we could go to and get these reports, and a point person to enter the documentation into, or the data into NHSN, we were then able to drastically improve our results.
So I would throw in here that if there's anyone on the call that works for NHSN or governs NHSN, this is a broken system. There needs to be a way for people to be able to call and speak to someone and get these issues resolved. This was a simple click of an Active Directory to make a change and allow Chris and everyone else who needed it the access. And honestly, Jeannette did a great job, but if it wasn't for the fact that she happened to personally know someone, then we would not be fixed yet. So it's definitely a broken system. If there's anyone that has anything to do with that, directly with NHSN, that is really something that needs to be looked at.
Thank you, Paul. Next slide. So now, as I said, we drastically improved our results. We, not now because it's not required anymore, but back in that time, we were reporting weekly as required. Our vaccination rates for our patients got up to 78%, which was just below the goal of 80%. And it continues to run smoothly to this point. Of course, there's always room for improvement. And one place that we've identified that we can improve on is getting our boosters documented. For some reason, it's much easier for us to obtain, just general vaccination status. But continuing to add the boosters onto it has been an issue. So we need to go ahead and, again, internally look at that and see how we can improve upon it. And that is all I have, Paul. If you have anything else.
No, great job.
Jeannette, anything else? Any questions?
Gotcha. Thank you, Paul and Chris, and Jeannette. I'm going to defer to Stephanie really quickly. Do we have any questions in our chat, Stephanie?
No, nothing right at this time, Gayla.
Okay, very good. And actually, I have a question or two for our speakers. So as it relates to NHSN, the National Healthcare Safety Network, for those that are on the call that may not be familiar with what exactly NHSN is, how are you, kind of tracking your vaccinations, or how you're using that information for more of a proactive approach, can you kind of just give a little bit more detail of your experience in using the system and how you're using that data?
You would like me to give that?
Sure, absolutely.
Okay. So NHSN is a system, and again, as I stated earlier, we are considered, at least this aspect is considered, home hemo dialysis. For outpatient chronic centers, it is a system that tracks infections across the board. And so the outpatient clinics need to, on a monthly basis, report all their infections to the system, as well as participate in a host of other surveys, if you will, best demonstrated practices. I know there's hand washing audits on there. I know you need to report your flu vaccines on there. For the home hemodialysis aspect of it, which is what we're focusing on today with our SNF programs, we don't need to do the infection control stuff. What we did need to do was the COVID vaccinations. So we needed a report on there. Again, back, it's eased up a little bit now, but back then we needed a report on there on a weekly basis our patient COVID vaccination status as well as our staff COVID vaccination status, and then report any patients that or staff members that may have become positive.
Very good, very good. And did I hear also you're able to obtain sort of best demonstrated practices or information that you can share with your team in terms of, like you said, hand washing and other ways to kind of maintain, healthy status with your patients as well as staff?
Correct.
Okay, very good, awesome. Thank you so much, Chris and Paul. Jeannette, any other questions? Any questions from you before we move forward?
No, I just wanted to say I thought, getting a point person at each nursing home was vital, and recognizing that it was not necessarily going to be the same role in each nursing home. Some have infection prevention nurses, some have the administrator is taking care of this, and the social worker. So that was very astute of him to find out which role was the best one for him to communicate with and his nurses to communicate with.
Awesome. Very good. Very good. Well, thank you, Network 4. We really appreciate all of your hard work, your attention to detail, and ways that you're resolving a lot of those issues to maintain and improve your outcomes. So kudos to you, and thank you for your presentation this morning.
Absolutely. Thank you.
Right. And so we're going to move forward to Network 6. We have Aisha Edmondson. She's a contract manager focused on quality improvement within the Georgia, North, and South Carolina area. So welcome to the call, Aisha. I really appreciate your being here.
Thank you, Gayla. I'm joyed to be here. Next slide, please. And as Gayla mentioned, I am Aisha Edmondson, QI manager for the iPro ESRD network, and I will be discussing some of our approaches that we're going to take for Network 6. Next slide, please. So our iPro ESRD network of the South Atlantic Network 6 covers, as she stated, 3 various states. We have activities supporting approximately 51,211 dialysis patients with end-stage renal disease, and these patients receive treatment at 804 Medicare certified dialysis facility, as well as 10 transplant centers. Excuse me. Next slide, please. Throughout our network service area and through our numerous community coalitions, we identified through our root cause analysis and our PDSA cycles that there were frequent top barriers related to vaccination. And as you all know, those barriers included vaccination hesitancy, mistrust in the healthcare system, vaccine fatigue, lower than average vaccination rates, as well as misinformation. And we continue to hear this from our facilities. So we decided to take a step back and thought about other ways to mitigate these barriers, while also incorporating our new weight reduction measure that we've been tasked with. We wanted to try to pivot the approach, thinking outside the box, while coming with a way to do the work that we do. We pivoted this approach and we decided to establish our Healthy Living Project. Next slide, please. In incorporating this Healthy Living Project, we wanted to introduce it to facilities as a way to navigate away from the conversation as it pertains to vaccines. People were tired of talking about vaccines. We're tired of the conversation surrounding vaccines. And so we wanted to introduce this new approach to facilities through our iPro Learn Forum, focusing on the association of vaccines with overall health as a way to incorporate patient health and safety, asking facilities to look for a wellness champion within their facilities to lead them through this approach. This wellness champion that we wanted facilities to identify and help facilitate this would also have the opportunity to work with the clinical staff and the dietitians and the social workers to promote health and wellness in their patients' everyday lives, focusing on optimal health for each patient to lead patients to better manage their I'm sorry, comorbid conditions through weight management, exercise, active engagement in their treatment plans, and preventative care such as vaccination and testing. Next slide, please. Through this approach, we wanted to change the narrative when it came to vaccines. While finding a way to get patients motivated, soon facilities will be receiving our ESRD Healthy Living Bingo as a way to both incorporate and educate patients on the benefits to managing their preventative and overall health in a fun, interactive way. The objective of this game is to help patients identify important terms related to ESRD to better their knowledge as it pertains to their own care, as well as a way to understand the dynamic of our healthy campaign. This is also an awesome opportunity to let patients connect in person with their social workers or virtually, while having fun learning about ESRD and healthy living. Next slide, please. And to assist the facilities in these efforts, we wanted to kind of also find a way to combat the severe staffing shortages that facilities are experiencing throughout the network service area, integrating patients into the work and communicating how that is highly important. And it also gives the opportunity to incorporate the patient's perspective and how the patient's perspective is vital to the success and has historically helped facilities with their patient engagement. Next slide, please. We also utilize our iProLearn educational forum to allow facilities to share their best practices, which then allows the network to highlight those facilities, communicate with them, and establish those relationships that also lead to inviting those team members to participate in calls such as the land calls, as well as expert teams. Next slide, please. And as we speak more to our Healthy Living initiative, we also wanted to continue to promote this healthy living through various ways. We wanted to be able to meet the patients where they are and identify and understand how to start small while working our way to better overall health through our fast food equity project. Understanding that due to various circumstances, our patients are often unable to obtain those healthier options. And so when we speak to healthier living and we talk about diets and we talk about wellness and we talk about incorporating that into our daily lifestyles, we didn't want patients to feel as though because they do certain things that it is negative or perceived as bad habits. So we wanted to kind of have an approach and hope to get input from our local dietitians, as well as our PFR Alliance that was previously mentioned, and showcase a need for a visual diet education that kind of resonates with our community. The network will be partnering with the community to make a visual My Plate, which will be an educational handout around popular fast food restaurants in the network and what patients can order if they find themselves needing to continue to eat this way, but to stay in their parameters of a kidney-friendly diet. Next slide. I believe that may be it for me. It is. But I would love to answer any questions that there may be in regards to this pivoted approach towards healthy living, as well as our ESRD Healthy Living Bingo.
Gotcha. Thank you, Aisha. I agree. That's definitely a very innovative approach because you've taken, like you said, patients, they get overwhelmed when they hear about vaccination. They, are hesitant in some ways. They are not as open to the conversation because they hear it often as an important topic. And so you took that important topic and your network and really turned it into more of a positive conversation. So very innovative idea. And I like it. So my question is, how has that approach really improved patient engagement when we're having those conversations surrounding vaccination? Are you seeing a much more positive response from patients at this point?
Well, we're actually implementing this now in our option year too. So we haven't received much back, but what I can say is that we have started to perform our on-site visits. And as we conduct these on-site visits and we walk into the facilities and we're having those conversations about how we're pivoting the approach and how we're creating these resources and interventions to help facilities have this conversation and again change the narrative. Facilities seem very receptive to this approach, and they're actually excited about introducing this as a way to talk to patients about vaccinations or preventative care. And just speaking to how we incorporate the wellness dimensions from various aspects. So it won't just be it'll be environmental, it'll be physical, it'll be mental, it'll be financial. It'll just try to incorporate so many different aspects because the objective is to have a patient in a better mind state to be more receptive to the information that they're receiving.
Awesome. Thank you. Thank you. And I also think it's a great idea how you're taking the healthy plate concept and really connecting it with what a lot of patients are eating, like you said, due to maybe food insecurities or maybe not having a lot of healthy options in their living space, but yet taking that same concept and helping them make better choices. So very innovative idea, and kudos to your network on that project as well.
Thank you.
Right. Stephanie, do you see any comments or questions in the chat for Aisha?
No, nothing at this time.
Okay, awesome, awesome. All right. So we're going to move a little forward here with our second poll question. So now that you've heard these presentations from Network 4 and Network 6, what is the likelihood that you will use some of those change ideas that were presented by Paul and Chris and Jeannette, and also by Aisha, as well as some of the ideas that you heard from the change packages? So love for you to drop some of those comments in chat, whether or not you think you will utilize some of these ideas. Certainly, if you have questions and need more further explanation of how these ideas are being utilized, we definitely want you to reach out to your network leads. And we can also get in touch with our presenters today if there's opportunity where you would like to connect and talk a little bit more about those ideas. All right. And so moving from learning to action. So you've heard a lot of great comments on the on our presentations today, a lot of best practices from your colleagues there in the ESRD community. And so we want to think about some of the aspects of the conversations today and how you can utilize some of those comments to really think about how you can present some of those ideas to your leadership team and implement some of those ideas in your facility. And so, as I mentioned earlier in our presentation, we have the ESRD National Coordinating Center change packages, and there's a QR code. So feel free to use your phone camera and connect with the QR code, and it will take you right to the change package. So you'll definitely have it there. Also, on our next slide going forward, we'll have our website. So we definitely want you to take the opportunity to utilize that information. So it is open to you to utilize as you see fit. And here's another couple of access to our information via social media and website. So we are on Facebook and on Twitter, on Instagram, as well as a YouTube channel where you'll see a lot of our recorded videos as well. And certainly if you have questions and would like to have more information, that's our website listed below. And with that being said, we're coming up to the end of our call. So we certainly appreciate all of your time and effort spending time with us this afternoon on this Learning in Action Network call. We definitely like to again thank our colleagues there at Network 4, Network 6, as well as our presenters, Paul and Chris, and Jeannette, as well as Aisha, with presenting such great topics today. And so we definitely want to hear from you. So again, use your phone camera and take our post